Welcome back. In today's video, we will discuss the signs that may indicate an increase in creatinine levels. Small changes that we often dismiss as the effect of aging can actually be the sign of underlying kidney problems. Today, we will talk about 11 symptoms that people, including doctors, often overlook. Your kidneys filter almost 50 gallons of blood every day. And when they are not functioning well, specific signs emerge that are usually attributed to general fatigue, lack of sleep, or stress. However, by the time these clear signs appear, the kidney damage may already be severe. Creatinine is a waste material formed from muscle use, and healthy kidneys remove it from the blood. When creatinine levels in the blood rise, it means the kidneys are not properly filtering the blood. According to the National Kidney Foundation, many people have kidney diseases without knowing it. The signs we will focus on today should not be considered a complete diagnosis, but when combined, especially in individuals with diabetes, high blood pressure, or a family history of kidney diseases, ignoring them could be dangerous. Let's go over the symptoms of increased creatinine levels. Number 1, fatigue. The first symptom is fatigue, weakness, and a lack of energy without any clear reason. Have you noticed feeling tired even after getting enough sleep at night? If your answer is yes, it is not simply stress or a sleeping problem. It might be a sign of slow kidney function. When the kidneys can't effectively filter waste materials, they build up in the body and affect the normal functioning of cells, leaving you feeling tired and unmotivated. This is not ordinary fatigue. It is a type of fatigue that does not go away even with sufficient sleep, coffee, or rest. It feels like your energy is slowly draining, your body is heavy, and you are unwilling to work. A situation often mistaken for stress, aging, or a busy schedule. The truth is, this could be the sign of a kidney problem. Number 2, brain fog. Second symptom is impaired cognitive function or brain fog. Many people attribute this to stress, lack of sleep, or aging. However, when the kidneys are not functioning properly, toxins can accumulate in the body and reach the brain, affecting its ability to think and process information. You may feel like your mind is foggy, struggle to focus, forget things frequently, and find it difficult to concentrate on a task. According to the National Kidney Foundation, when toxic substances reach the blood-brain barrier, the brain systems is affected. People experiencing this often have to read the same paragraph multiple times but still fail to understand it and feel anxious while performing everyday tasks. This condition gradually worsens and is often dismissed as a lifestyle issue, but it is actually a sign of declining kidney function. Number 3, nausea and loss of appetite. When creatinine levels rises and the kidneys are not functioning properly, it can poison the digestive system. This leads to loss of appetite, a metallic taste in the mouth, or constant dizziness and nausea. You may notice that your favorite foods no longer taste good, or that you feel full after eating only a small amount. The dizziness may start subtly but can become an everyday occurrence over time. Because these symptoms are quite common, they are often attributed to stress or digestive issues, causing many people to overlook them. Number 4, swelling and puffy eyes. If you notice that your rings feel tight, your shoes become snug during evening, and slight swelling appears around your eyes in the morning, it might be due to fluid retention caused by kidney dysfunction. According to the National Kidney Foundation, healthy kidneys regulate the balance of water and salt in the body. When kidneys become damaged, water accumulates within the body. This condition is called edema. Swelling initially feels mild but worsens as the day progresses, sometimes being mistaken as normal fatigue or a seasonal effect. However, often this is a sign of kidney issues. Number 5, changes in urination. According to the National Kidney Foundation, a rise in creatinine levels first manifests as changes in urination habits. You may frequently wake at night to urinate, a condition known as nocturia. Additionally, the urine may appear foamy or consistently bubbly, which does not dissipate quickly, indicating the presence of protein in the urine referred to as proteinuria. Some individuals may notice their urine is lighter or darker than usual. however, may often attribute these changes to insufficient water intake. Number 6. Itchy and dry skin. When kidneys fail to eliminate toxins from the blood, the skin becomes affected. According to the National Kidney Foundation, dry and itchy skin can be an early indicator of kidney problem. This itchiness becomes more pronounced at night and differs from allergy-induced itching because moisturizer or anti-allergic creams do not provide relief. Over time, the skin becomes noticeably dry, rough, and loses its moisture. Many people may think this is caused by seasonal changes or the use of soaps, but it can be a sign of kidney dysfunction. Number 7. Muscle cramps. When kidneys are unable to perform their functions correctly, imbalances in electrolytes such as potassium, calcium, and phosphorus occur. These imbalances lead to muscle cramps and pain. The Kidney Foundation of Canada notes that electrolyte problems can be detected even in the early stages of kidney disease. Initially, cramps may occur at night or during exercise, but they gradually become more frequent and severe. The pain is distinct from its normal soreness experienced after exercise. Some individuals describe it as if they have excessively strained their body. Muscles fatigue easily and the pain feels persistent. Often mistaken for stress, aging, or simple fatigue, this could also be a sign of problematic kidneys. Number 8. Sleep issues. When kidneys fail to filter out toxins, these toxins accumulate in the bloodstream, affecting sleep quality. According to the National Kidney Foundation, sleep-related problems are common in those with kidney diseases. Some individuals struggle to fall asleep while others frequently wake up during the night or experience restless leg syndrome, a peculiar sensation of unease in the legs. Even after sleeping for 8 hours, it may still feel like the rest was not enough. This occurs because the toxins disrupts the sleep cycle. Over time, sleep difficulties become chronic, accompanied by persistent daily fatigue. Number 9. Bad breath. Most people easily think that bad breath is due to poor oral hygiene. But in truth, it can also be a sign of kidney problems. When the kidneys are not functioning properly, toxic waste that accumulate in the blood can affect not just internal organs but also taste and breath. According to the Kidney Foundation of Canada, changes in taste begin at the onset of kidney problems. At first, you may notice that food no longer tastes as good. There may be a decrease in appetite for sweets or a strange metallic taste in the mouth, particularly in the morning upon waking. This taste worsens over time. Similarly, foul-smelling breath or bad breath could be a symptom of damaged kidneys. This odor is different from ordinary bad breath. When the kidneys are not functioning well, some toxins are released through the lungs, producing a smell similar to ammonia or fish. Usually, people think the problem can be solved by brushing teeth, using dental floss or mouthwash, but the odor returns after a few hours. If bad breath frequently recurs or your sense of taste changes, it should not be ignored. Number 10. Cold intolerance. If you feel cold all the time, even though the temperature is normal for others around you, it may signal an underlying kidney problem. When the kidneys are weak, they stop producing a hormone called erythropoietin. This hormone is essential for the production of red blood cells. When red blood cells are insufficient, less oxygen is delivered throughout the body, causing continuous coldness. Initially, this cold is felt only in your hands and feet, but it gradually spreads through your body. Some people report being unable to feel warm no matter how close they are to a heater. This tends to worsen over time, and people often blame it on the weather. But in truth, it could be caused by malfunctioning kidneys. Number 11. Unintentional weight loss. Typically, people attribute weight loss to changes in diet, stress, or increased physical activity. However, if you gradually lose weight without changing what you eat or your lifestyle, it could be a sign of kidney problem. According to the Kidney Foundation of Canada, in cases of kidney problems, weight slowly decreases because the body can no longer absorb essential nutrients properly. Initially, you may notice just a few pounds lost, but in truth, it's due to a lack of necessary nutrients. If your weight decreases unintentionally, it may not just be a result of stress or diet, but a serious indication of kidney problems. Medical testing. When we learn about these 11 symptoms, the question arises, how can kidney problems be confirmed? The most important and simplest test is a basic blood test that checks the serum creatinine level. However, relying solely on creatinine makes it difficult to understand the full picture. Often, doctors calculate EGFR or estimated glomerular filtration rate, which indicates how efficiently your kidneys are removing waste from your blood. If EGFR is below 60 and remains that way for 3 months, this could signal chronic kidney disease. Additionally, urine tests are very important. These tests show substances not commonly found in urine, such as protein, blood, or foam. The urine albumin to creatinine ratio test is another essential test, highlighting potential protein leakage from the kidneys. This test is especially crucial for individuals with diabetes, high blood pressure, heart problems, or a family history of such conditions. Other tests like ultrasound, blood pressure monitoring, or specific condition tests may also conducted. The most crucial point is that these tests should not be done only when symptoms appear, but rather regularly, especially for individuals with risk factors. Early detection can prevent or slow kidney damage. Alright, thanks for watching the video. Please subscribe to watch more. Have a nice day.